Hello everyone, welcome to our channel. Today's topic is about vaginal birth and cesarean section. We will discuss what they are, their advantage, their risk, and when each method is recommended. So there are two main ways of baby can be born. The first one is like a vaginal birth or the natural birth, and that is the way the baby is delivered through the birth canal. And the second one is cesarean section or C-section. The baby is delivered through the surgical incision in the mother's abdomen in uterus. Both methods are safe, but the best choice depends on the health care of the health of the mother and the baby, and the advice of the health care team. So, what happened during the vaginal birth? Birth. What happened? What happens during the vaginal birth? Vaginal birth usually has three stages. The first stage is the cervical softens and opens or dilates to the 10 centimeter, and while contraction become stronger and more frequent. The second stage is the mother pushes and the baby is born. The third stage is the placenta is delivered after the baby. So, what are the advantages and the possible risks when the mother is just giving birth through vaginal birth method? The advantages there will be shorter hospital stay, fast recovery, lower risk of complication from a major surgery, and also earlier moment after birth, skin to skin contact, and breastfeeding often being begin sooner. And there are also possible risks. The first one is about tearing in the vagina and the perineum, and also heavy bleeding in some cases, and long or difficult labor, and also emergency C-section may become necessary if complications develop. And also let us we watch about what happens during a cesarean section. A C-section is a surgical procedure. The mother usually receives a spinal or epidural anesthesia, so she is awake but doesn't feel any pain. The surgeon make an incision in the abdomen and uterus to deliver the baby. After the baby and the placenta are delivered, the incisions are closed with stitches. This also have advantage and also possible risks. So the advantage can save the life of the mother or the baby in emergencies and help when a vaginal birth is unsafe. Thus can reduce reduce birth injuries in a certain high risk situation. And also there are possible risks. The possible risks like long recovery time, higher risk of infection and bleeding, more pain after surgery, and also a greater chance of blood clots, a possible complication in the future pregnancies. So, when is a C-section recommended? Healthcare providers may recommend a C-section if a baby is in a breech or transverse position and the labor is not progressing. The baby shows like a sign of distress, and the placenta covers the cervix or the placenta previa, and the mother has a central medical condition, and there are multiple babies in some pregnancy. So this also when this type of situations are happen, the C-section is recommended. So when has been a previous section and also there has been a previous section, and depending on the individual situation. So let us we compare the two ways of giving birth as we just watch about the recovery of the both ways. The vaginal birth is usually faster than the c-section. The section usually takes longer because it is a major surgery. And as we watch about how long they will stay on hospitals, the vaginal birth they are just stay hospital within about often 1 to 2 days, and the C-sections one are just going to stay at hospital about 2 up to 4 days, depending on the recovery. And pain after the birth, the vaginal birth. The pain is usually around the vaginal area, and the C-section pain. The section one is the pain is mainly at the surgical incisions. So future pregnancy, the vaginal birth usually. Fewer surgery related concerns that have only a fewer surgery related concern, so it's going to be good for just to get pregnant sooner after we have a baby or after one mother have a baby. And the c-section one, future pregnancy may require additional monitoring because of the uterine scar. So both vaginal birth and cesarean sections are safe way to deliver a baby when managed by a trained healthcare professionals, and the goal is always to be safe and well-being of both the mother and the baby. Discuss about the methods of the delivery should be made with qualified healthcare providers based on each pregnancy unique circumstances. So everyone, thank you for watching this video. If you found this video helpful, please like, subscribe, and share. See you in the next time. Bye.